Hello, everyone. Today on our podcast, Results Beyond Dispute, Profiles in Excellence, I am so pleased to welcome one of the world's most acclaimed global health experts and thought leaders, Sofia Gruskin. Sofia directs the USC Institute on Inequalities in Global Health, which is a pan-university effort and engages faculty, staff, and students from across the university. She's a lawyer with extensive experience at the intersection of health, law, and human rights across a range of key global health topics. Currently, Sofia is a professor at both the Keck School of Medicine and the Gould School of Law. Prior to joining USC, Gruskin was head of the Harvard School of Public Health program on international health and human rights, chair of the group on reproductive health rights at the Harvard Center for Population and Development Studies, and co-director of the interdepartmental program on women, gender, and health. And if all of that was not enough, she somehow is able to manage to navigate the tricky pronunciation of GRU in one's last name. She's the only one on today's show who can actually pronounce her own name. So if that by itself is not a reason to acclaim, nothing is. Sofia, welcome to the show.
Thank you so much, my friend. How are you?
Good. So in my first question, I'm going to be channeling my son, of all people. When David, our son, was, 5 or 6 years old, we used to love to tell jokes to each other. And you can imagine the type of jokes that a 5 and 6 and an immature 30-some-year-old father tell each other. But my go-to joke had to do with the enmity between doctors and lawyers. And it was sort of it's a disgusting joke which need not be repeated today, but basically it had to do with the lawyer spitting in the doctor's coffee and the doctor in turn throwing, pasta on the lawyer's head. And it all had to do with the enmity between those two professions. You have an appointment both to the medical school and the law school, so channeling my son, what are you thinking?
I must hate myself, right? That's what's going on. So I guess a couple of things. So I came into this through law, and initially my focus really was in law, but what I became interested in was the effects of law on health. And so out of that, really had to understand much more about health, which brought me first into a school of public health when I was at Harvard. And then at USC doesn't have its own school of public health. So therefore, that puts me into the medical school.
So how did we get here? Where did you spend your childhood? What was your childhood like?
Oh, boy. Okay, let's try. All right. I grew up in Los Angeles and was here. My parents were both of them very much on the artistic bent. There was not a lot of money in the household, which also meant that we moved every year pretty much to different places. But at that point, pretty much in LA. The other thing that I guess I should say around that is that we spoke French at home and that was really relevant, but then we had family in Spain. And so part of that is already the fact that there's already kind of this kind of global space in my head about kind of how I operate in the world, even as a little in. Right. And so what happened just in very quick, and obviously I can go into anything more, is that I was thinking that I was going to be in university. I really wanted to do sound and lights for rock and roll. That's really what I wanted to do, and I was very serious about it. I see you laughing, but I was very serious.
No, I'm appreciating.
Okay, and so I was very serious about it, and what happened in terms of kind of that sort of techie dream is that, of course, you end up having to make money. And I ended up getting a position as a paralegal in a wonderful law firm in San Francisco. And that in the position as paralegal, I now understand. I was excited because I wanted to do public interest work. So they let me do a lot of the pro bono work. I now understand that's because I was a lot cheaper for them, but I didn't realize it at the time. I thought it was phenomenal, right? And so because of that, but I was also in San Francisco in the early 80s and HIV hit. And at that point, friends of mine were really sick, and all of a sudden it became really clear to me I needed to know more about health. So I guess that is the intersection. How's that?
So I will say, for my own sake, that for whatever little I've accomplished in my life, if I could become a Bruce Springsteen roadie, I would say all of that in a second and follow the boss until he won't have me anymore. Okay. So that completely resonates. You mentioned that your parents were autistic and in the industry, and I know that you actually almost got involved in that as the child actor. Can you talk a little about that?
Sure. I guess the thing to say is when I was 4 years old, I was in ballet class, and because I walked with my feet pigeon-toed, and they were looking for little girls to dance around Gene Kelly on the Danny Kaye show. So I was brought in to be one of those little girls, and because I'm the neurotic person that I still am now, when I couldn't find my place on stage as everybody was dancing, I kept dancing. And so even though the music had stopped. And so Danny Kaye called me over, and then imagine that, I'm very verbal. We ended up into a conversation, started talking, and so I did that for this period of time. And to be very honest, I also supported my parents during that period for quite a while in terms of that. But I was doing, so I did a lot of TV as a child. And at a certain point, my parents kept giving me kind of barriers of things that I had to do. Like I had to learn how to read and write if I wanted to do more of this. I had to do different things. And so over this period of time, I did that. But then there were a couple of roles that I was offered that my parents would not let me do, and that kind of moved me out of that space.
Okay, so I gotta ask, which roles did your parents not let you do?
Okay. Okay. All right. Okay.
Spill the beans. Let's have it.
All right. So the middle child on the Brady Bunch, the middle girl on the Brady Bunch, my parents didn't want me to be in a series because they thought that it would affect kind of my engaging in intellectual pursuits, et cetera. And then the other one was the little girl in The Exorcist, which was the same thing. And so it's one of those things where those things are so far removed from my sense of myself as a person that I don't really talk about them, to be honest.
Got it.
Okay.
By the way, as an aside, following up on something you said, I think you characterize yourself or describe yourself as a bit neurotic. Neurosis is completely undervalued. Nothing would ever get done in this world unless neurotic people went out and went about and did it. You mentioned that you were a paralegal. You were a paralegal at Munger Tolles, which is one of the finest law firms in the world. When you were doing that, did you have a sense that you were going to go into big law and become a partner, or even then, did you know that your path may be a little different?
So can I back up a little bit? So Munger Tolles was in LA, but before that, I was at Pettit and Martin in San Francisco.
Got it.
So it was also like a fantastic law firm in terms of just being able to look at things. And at that time, so I was there, and what I really thought was that I was really interested in the work, particularly the public interest work that was happening. And so that was true at Pettit. And then that continued essentially kind of in terms of, and so the trajectory in that sense is that after Pettit and Martin, I left and I went to Europe. And I went with a one-way plane ticket. and wasn't sure how I was getting back. And I ended up getting a job in a law firm in Paris as a paralegal. And then that connected me to then somebody at Munger, which is how I ended up coming back to Los Angeles, how I ended up there. I just wanted to be honest about like
all good
pieces of it, right? And so I really did fall in love with the law, but I didn't fall in love with corporate law. And I was really always, there's a history in my life. I've always been really concerned with inequality and with inequalities in general. And I was really struck with the fact that in these wonderful law firms that we're talking about, there was space to do that kind of work.
Fast forward many years, what led to your decision to leave Harvard to come back to USC in LA?
Okay. So my darling husband and I were living on two coasts for 10 years. And so he had gotten a position in LA. He's an academic who focuses more on kind of different kinds of work. And so we were trying to figure out how we were going to be in the same place finally to be able to do that. And for a variety of reasons, LA became that place rather than Boston, where I had been for a really long time.
Right. Lucky all of us.
Thank you.
How did the Institute on Inequalities and Global Health come about? What is its mission? Can you talk a little about the institute that you had?
Sure. I mean, with great pleasure. So I came to USC, and basically my interest was in understanding how it was that we could think about if we could really create something that could bring together different schools, because my sense is that no one discipline owns global health. It requires all these disciplines to come together. And so what happened is that there was a lot of thought about how to think about how to bring the schools together and essentially how to ensure that we could do research, that we could do education and training, but also that we could do policy engaged work that was at that intersection. And I think the most important thing and the really great thing about USC was the sense that this is a place where if you wanted to do it, you could do it. And so there was this sense of being able to work with different deans, with different faculty, in terms of being able to see what was possible. But if I can say also different students. One of the things that was really exciting, when I was at Harvard, Harvard was fabulous, but one of the things was I was dealing with public health students. That's really who I was dealing with. And to all of a sudden be dealing with communication students and policy students, as well as social work, as well as law, as well as cinema, was kind of amazing. And so that really helped us to shape our mission to start with. And what's been really exciting is that the university understands the need to focus on inequalities and what that means in terms of our focus, in terms of what we do.
And when was it that you came out and established the Institute?
So I established the Institute in 2019. I came out in 2013. And during that period was really getting to know the institution, frankly. And I was recruited and brought my program, which was called the Program on Global Health and Human Rights. I brought the program from Harvard. And so that program initially was focused only in the medical school. And so when the Institute was created, when we created the Institute on Inequalities, at that point we became Pan University.
So, as you know, I spent part of my childhood in Africa, mostly in Ethiopia in the mid-'60s and the early '70s. And as I was preparing for our little chat today, I was just curious. So I looked up the life expectancy in Ethiopia in 1966 when I was living there. It was roughly 41 years old for a combined male and female Ethiopian. And in the United States, it was back then 70 years old. Today, in 2026, life expectancy in Ethiopia is 72 years old, and in our country, it's 79 years old. So I know this is just one data point, and there are gazillions of data points, but doesn't that suggest that there has been some significant progress in global health outcomes across the table?
Yes-ish. Yes-ish. I mean, I think that one of the things is that we've come to learn that it's easy to reach the 80%. It's the 20% of people we don't reach that I'm most concerned about. And so what you're pointing to is the fact that increasingly since the 60s, there's been an increase in the ability to get people in urban areas, to get people who can connect to health systems, who can connect, who understand what prevention is about. And there's that 80%, which is what has really helped to kind of grow what everybody is doing. But again, back to my inequalities focus, I'm interested in the people that are not easily reached. I also do need to say, in reality, that at this point, the last year and a half or so, and kind of this mantling that's been happening around global health architecture is really threatening kind of those statistics that you laid out.
In the realm of global health inequalities, what does success look like?
So I'll start with hitting that 20%. Let me just say that. And when at that point, and what I mean is not expecting the most perfect outcomes in terms of being able to say that 100% of a population of a particular place are going to have exactly the same health status, but instead to be able to say, first of all, that the systems are paying attention and are really prioritizing those populations who are the most marginalized and those that are hardest to reach. And one of the things that's really difficult, coming back to the effects of law, is for people whose behaviors are criminalized, or for people who fall outside the law because they were born and don't have citizenship papers, because they're not recognized because of migrant status, because of all those things, those people don't get access to the things that they need to be able to do it. So success with those people really looks like their engagement with the system. So I'm not focused so much on the individual human, so much as at a systems level, the difference that can make.
Isn't it fair to say that throughout human existence, there always has been inequalities when it came to global health? Isn't it almost part of the DNA of what it means as a society to be human?
100%, and isn't part of what it means to be a society to try to address that as best as we can. 100%, I'm totally with you,
What if we fail to make progress with the 20% that you just described? What are the implications?
Well, I think that the implications, we're going to talk about the 2080s and then we can get more granular if you like. But I would say, first of all, the implications are not only for the health and well-being of that 20%, but increasingly what it means for the others as well, for people whose life expectancy and health status was already improving. So I think one of the things we have to recognize, it sounds so silly, but we're all in this together, right? And so we're one globe, and it's not as though infectious disease makes a decision and only focuses on one set of people and not on another set of people. And it's also not as though we're able to, it's not as though we're not able to basically try to address what the issues are for all people. And one of the things that I'm really struck with is that even within the 20%, just to be really clear, there's a difference. Let's just say that you say, okay, I'm concerned about reproductive health. The reproductive health of somebody who is living in an urban area versus somebody who's living in a rural area. The reproductive health of somebody who has documentation and has papers versus somebody who doesn't. There's all these little layers that all relate to ultimately what that person is able to access and what they're able to do. And so basically from the perspective of thinking about what does this mean globally, we really need to be thinking about, why are the inequities, even here in LA, right? The inequities that we have here are as bad as they are. And so for me, it's not about flattening the line and saying, okay, everybody should have the same level of health, even if that health is bad. It's to basically be consistently, from a rights perspective, thinking about how do we improve health and well-being for everybody.
Are you and your colleagues sometimes forced to make decisions where you will put resources to fighting diabetes, but for a whole slew of reasons are unable, or it's not practical for you to deal with reproductive health, which have religious, moral complications, for lack of a better word? Do you have to choose where you go in order to get half of the loaf?
Not me personally, but let me answer it in a slightly more meta way, I guess, for lack of a better way to say it. I think that one of the things that has increasingly happened is that governments are prioritizing health issues that are easier to address. And so the question is, do you address those easier issues? Or do you not, because you're wanting to hold off for those things that are harder? And obviously you're going to go for the easier rather than stay away entirely. I think one of the things that's most important, though, in terms of that, is being able to say, what is it that the communities, what is it that the population, what is it that the area that you're working with, what do they see as the most important health issues, and always trying to make sure that those issues are part of it. I have a real concern, I just have to say, as somebody in a US-based research university engaging with folks and health issues that are not just within my borders, but in other people's borders, there is a colonialist history to global health. And that is something that we need to work against and that we really have to work together to move beyond. So I'm very careful about when you ask about prioritizing, like who's making the priority decision.
Okay. You've alluded to this already, but I really want to sort of jump in. In the course of your career, you have partnered with the World Health Organization, with any number of UN programs, with Open Society foundations, with a whole slew of international organizations. Many of these organizations are seemingly under attack these days. From someone who's currently in the weeds, what are you finding? What can you report back to us?
Oh my goodness. All right, let's do this. But okay. So let's talk about a couple of things. First of all, at the global level, in terms of what's happening around priority setting and decision making. What's happening is now that the US has pulled out of the World Health Organization, along with now Argentina, but now that the US has pulled out of WHO, we are no longer part of the global discussions. And so what that means is that increasingly what I'm seeing is the fact that, quite rightly, frankly, countries are making the decision to go without the US. Now, while that may actually in some way strengthen what's happening in other places, it actually weakens things for us. So for example, if there's a measles outbreak here, right, in the US, we no longer can count on international support in terms of how it is that we address that, whereas other places can. But what's interesting, just because we're in California, is that Governor Newsom made this decision to try to join the Global Pandemic Preparedness Network as a state, which is kind of an interesting thing in terms of thinking about international law and how that works. But the fact is that having joined that, so not WHO as a whole, but that piece, that means if we have a measles outbreak in California, we can get some support in terms of being able to do that. So one issue is simply about reporting around disease and being able to actually think about what does it mean around kind of how health issues are addressed. There's also the question in terms of for people who are, so one of the things that's been complicated is the fact that the US is pushing these bilateral health agreements. And the bilateral health agreements with governments are being set up in such a way where they are quite explicitly, I mean, I'm not saying anything out of turn, quite explicitly, it's an America's First agenda, which means we will give development aid related to health, provided that you give us minerals, access to data, access to things without necessarily offering those data back to the communities that need them. So, yeah, go ahead. Yeah.
So, in a world where definitionally there's limited resources, there's limited money, there's limited professionals who are properly trained, there's limited, you can't do everything all the time at full speed. Is there an appropriate tension between spending limited resources on the one hand on global international inequalities, and on the other hand in the inequalities that still very much exist in our own country?
Sure, but is that what you're seeing? And I mean that sincerely, right? I mean, let's start with that, right? So is the focus, is it that all the resources are now being diverted to actually take care of the inequalities happening in this country? I don't think so, right? I don't see that happening, right? And so again, it comes back to the interconnectedness of issues. And also, you know, one of the things that I feel that I really need to say is I don't actually see initially that there's a problem with any government, our government, any government, deciding that they're going to shift priorities. The issue is not doing it recklessly. And the issue is the speed at which this is happening now and the harms that this is causing, not so much the fact that perhaps there's a decision to move somewhat differently. You can't turn an on and off switch, right, when you're talking about people's lives. And I think that's, where my issue comes in. So I hope that's responsive to what you're asking.
Yeah. In your view, is this still remediable, or it's going to take a lot of effort to undo some of the things that you just pointed out and that are of such deep concern to you?
So, I see a couple of things. Like I said, I see a resilience happening in terms of how institutions and how governments are engaging right now on their own. So in that sense, and whether it leads to a reconceptualization of the global health architecture, that may not be a bad thing, right? I'm not necessarily saying everything was so perfect and we need to keep things as they were. But there is a question about what gets prioritized. I think one of the things that was really important about the way that the position that the U.S. took often in terms of back to inequalities, took in the context of its work in other places, is that it would often work on those issues that were not the first priority for the government. And so those issues that dealt with populations that were more marginalized, that dealt with the legal environment and the implications that those things would have, et cetera, right? That dealt with gender-based violence, that dealt with those issues. What happens now is that those issues are off the table, nobody's funding them, and then governments are then prioritizing the issues they always prioritized, except even in a more limited way, because now there's an extra tax on them for even engaging.
So when you face such a fundamental issue, or any other fundamental issue that you've had to deal with in the length of your distinguished career, do you have a law brain that goes into it as opposed to your public policy brain, or how do you approach issues that definitionally are multifaceted and multidisciplinary?
Well, I love that question. Okay, let me try. All right. So let me say that I start with law, right? I always start with law. So I always want to understand what's the legal environment. Is it helpful or is it harmful in terms of what's there? So that is always how I come in, right? The issue is as you know well, that there's a real difference between the law on paper and the law in practice, right? And what it means. So the first issue then is, what is the law? How is it being implemented? Is it being implemented both positive and negative, right? Because sometimes there are bad laws on the books, but then there's a decision made by government to just leave them, but they don't engage with them, right? So that may be better than whatever. So I start with the law side. From the law side, what I'm looking to is, what difference does the law make for health outcomes? What difference is the law making? Is it improving health, or is it not? Is it actually being harmful to health? And so one of the things about that is I start with the law and the policy and what's intended, look to see if the data is helpful to being able to show. Yeah?
Yep.
Okay. And so I have a number, and I think it's coming back to the multidisciplinary nature. I know enough about epidemiology, about biostatistics, to know if something doesn't look right, but I don't know enough to actually deal with it, right, from that side. I do on the law side, right? So it's just a question about, that's why you need partners and people that you work with who have it kind of on the other side as well.
Yeah, no, I think that experience translates to many of our own personal lives, right? We know something is wrong with, a teenage kid. We don't know exactly what's wrong, but we know something is, and we need to talk to people and try to figure that out, and you're doing it professionally on a global level. A related topic. You are a distinguished professor in a extremely distinguished academic institutions dealing with many other distinguished academicians across the globe. It feels like academia is also under attack, at least some aspects of it. What's the mood among your colleagues, not necessarily EUC, but writ large, these days, early 2026?
Yeah, I mean, I obviously can't speak for all my colleagues, but I will.
Of course.
I'll do my best.
Just what is your view? Yeah.
Yeah, no, it's fine. It's totally fine. But I was just, so, one of the things that is really striking is that, and I'm going to say something quickly about the US and then I'll move beyond, which is that it's also really striking that for so many academics in my space, that we were all so dependent on one government in terms of the funding, in terms of what that would mean, in terms of being able to do this work. And so one of the issues is precisely in terms of being able to think about what are the other funding sources, the other approaches, the other kinds of institutions that are interested, the other governments that are there. So that's one piece of it, which is just the resources to do the work that needs to be done. The other is, what does it mean in terms of what do we teach our students? And I think I really want to, I just feel like incredibly important right now is that it is such a different world. Like, I was teaching this morning, I got law students and medical students, public health students, kind of bringing those students together. And, how is it that we can teach people the skills that they need in such an uncertain environment and in such an uncertain kind of way of operating? And I think part of what I'm thinking is in terms of what it means for teaching is more and more it means about teaching much more soft skills, because it's much more about how to engage with others in terms of being able to do that. What it means in terms of, your bigger question about being under attack, I mean, in some ways, one of the things that is really tough is, let's just be honest, the US government websites used to be were the most trusted in the world. I'll just say, we knew the data that was out there was, with words that have now been banned, with data that has now been changed, with all of those different things, we're now in a position where there's not a lot of trust even in the data that is out there. And so there's a lot of efforts now moving globally to think about how do we preserve those data sets? How do we hold them in different countries? How do we make sure that people can access them? There's a whole lot of things that are happening now to try to do that, which really requires global networks. And one of the things about that is those global networks were formed over decades of people who trust each other and who work together. And then I come back to, how do we teach our students now in a world where there isn't that? You don't have the opportunity to engage in the way that I guess we did in some ways.
So focusing on your students, you've been at this for decades at this point. How have your students' skill sets, attitudes, goals changed over time?
I think what hasn't changed is the mix of both desire to change the world and incredible cynicism. That mix of, like, in the same human, I don't mean as like totally different students. That mix, I think that is consistent, right? And I think and I actually think that that's a really positive thing, not a negative thing, right? In terms of that, I think that what has changed is that as jobs are getting more narrowly defined and more technocratic, I think that one of the things that's changed is that I think that people are pigeonholing themselves much more into very finite little boxes, as opposed to thinking that I want to work on this range of issues, let me think about this range of skills. It's more like, I need a job and therefore I need to know exactly how to do X and Y. And I think that that's quite different than how it used to be.
It's so interesting because when I get approached or when I speak at law schools, one of the first piece of advice I give law students is don't specialize too soon in your career, because you never know which window will open at one point. So taste a little of everything, and then you will have more options that way. And it sounds like in your world, you're giving the same advice, but circumstances are dictating different choices for the students.
Right, although I will say that I'm giving the same advice, but I'm not sure the circumstances are truly dictating that so much as people are scared. And so I feel a little bit like part of what I'm trying to do is what you do, is to try to say, no, you need to allow yourself to be more open, because that's not necessarily going to help you in the way that you think. I think there's a sense of people are thinking about the job immediately, and they're not thinking about the career. And I think that that's about kind of how to move that.
So, as I think you know, I, like every other interviewer, am required by federal and state law to ask a question about artificial intelligence, no matter what the topic at hand is. So, in order not to get fined, is AI part of the solution, part of the problem? We don't know enough yet. Where does AI fit into your global inequalities fight?
Both. How's that? Let's start with both. Okay, so let me try to clarify what I mean. I think that's really funny. I totally hear you. So, I think that one of the things right now about AI in general is, no, we don't know, right? We don't know. But it is also true that there are things that AI can do that can make things move much, much more quickly and in a very, very helpful way. And particularly when we're thinking about people in very resource constrained settings, the idea that people can access immediately and to be able to know on an app that a home care provider can have on their app kind of the information that they need is unbelievable, right? In terms of just like what it can do and the implications. The problem is, of course, who is it that can access that app? Who cannot? How many people are able to access those data? And I think one of the things that's been really striking to me about this is that I think that every discipline, every community, every institution that I'm dealing with is trying to grapple with exactly what you're asking. I do realize that, if we don't get ahead of it, it will get ahead of us, right? So we really are in a situation of needing to understand how best to understand what we can do with it. I guess the only other thing I want to say about AI is that I have had colleagues who are incredibly afraid of AI, for lack of a better way to say it, and concerned about, students are not going to learn, students are not going to be able to do this, these institutions, we don't know if this was written. That's not my worry. I actually think what we need to do is we need to be able to figure out how do we train people and how do we train ourselves so that AI can make us better at what we do. That's where I think we need to be, not just to remove ourselves from it. Does that make sense to you?
Yeah, it does. And is that what you mean by getting ahead of AI? Is that part of what that looks like?
Yeah, absolutely. So it's engaging with it, not removing ourselves from it, because I don't think that at this point that's going to be particularly helpful.
Okay. Sophia, you will sign for me that I asked the AI question and I'm good for...
100%.
Okay.
I'm not sure.
We talked a bit about your concerns and fears. What are you hopeful about?
A couple of things, actually. I am amazed by the ingenuity that's coming out in terms of how people are addressing the current moment. And I think that is something that is not just I don't mean that in a blah, blah way. I mean that in a real way, in terms of kind of what does it mean in terms of how it is that institutions are starting to think about how they work together, what it means about how it is that new solutions are coming forward. What I'm hopeful for is the fact that I think that maybe there's a level of humility and humbleness that comes with this. I'll tell you, I have colleagues from several countries in Africa who were here last week, and one of the things that they were talking about is the fact that, is the U.S. finally realizing that we may have dealt with some of the problems you're dealing with right now, and perhaps we have solutions that we can provide that if you would listen, and we always had those, and this is starting, and now people are actually starting to listen in different ways in the U.S., in countries that perhaps were a bit more arrogant about thinking that they had the solutions. So what I'm hopeful about is in terms of thinking, coming back to my concerns about kind of the colonialist history of global health. I mean, I think one of the things that I am very hopeful about is that I do think this is shifting the balance, and I think it's shifting it in a really positive way. Not the way it's happening, but in terms of the bigger kind of picture of it.
The process may be flawed, the result may be positive.
Exactly.
Okay. This has been spectacular. Our time is coming to an end, but before I let you go, I want to give you the figurative microphone. You've had it all along, but I'm handing it to you. To address the director of your institute in 2056. So it's 30 years from now. I'm sure by that point, it will be known as the Gruskin Institute. To impart on them what your hopes and dreams were today at a clearly critical moment in the fight for global health equality. What would you say to them?
Wow. Okay. I would say congratulations. The Institute's still there. Let's start with that. Okay?
No doubt.
Okay. But I would say a few things. I think, first of all, one of the things we didn't really talk about is kind of the kind of topical areas that we think are most pressing for right now. And I think one of those things, so I want to name those three because I think it's definitely relevant to responding to that. So one is healthy longevity and what that means as populations around the world are aging, and essentially trying to understand, again, how the policy environment and how the environment more generally can support. One of the things that I would imagine in terms of that is I really do think that I could imagine that the problems would be quite different, because the problems would be much more about then essentially as people are living longer, then what are the newer issues that are coming up? And so that's one area. The second is because we're concerned with climate and sustainability, right? When you ask about that, and I think, all right, so what in 2056, did you say? Yeah, in 2056, essentially, I'm hoping that we would have a much clearer climate agenda as a globe in terms of what that means, and much more uniformity in terms of what it means to addressing climate. And so within that, I think that would be super kind of useful to think forward. And then the third thing is thinking around kind of the areas of like kind of human sexuality, sexual and reproductive health, kind of that range of issues that are there. Those issues aren't going anywhere. Like those issues will remain into perpetuity. But I think what would change is, in the ideal, back to my hopeful, is that there would be a more accepting legal and policy environment that would exist, that would support people to flourish, whoever they are, in ways that are really helpful. So that's, I guess, what I would say.
That's totally inspirational. Sofia, you never quite made it to the box on the Brady Bunch. But if it had to be one or another, I think the multitude of people around the globe who are happy that you have built the amazing career that you have and what you're doing with it. There's innumerable number of people who are benefiting from your thinking and the effort that you're putting into making this world a somewhat more equitable place. So thank you, and thank you for being on this show.
My pleasure. But thank you, such a generous thing to say. Thank you.
That's it for today. Thank you, Sofia. We will see you next time on Judicate West, Profiles in Excellence.
Thank you for listening to Results Beyond Dispute from Judicate West. Views and opinions expressed by the host and guests are their own and do not necessarily reflect those of the organizations with whom they are affiliated or of Judicate West. Until next time.